Hi. So I'm having another conversation, innovations at work. This is Sophie Wade, and I'm really excited to be here today and having a really great conversation, very topical, very, very timely. We're dealing with lots of different challenges. We're doing lots of different restrictions and easings in different places. So how do we do that? How do we go back to the workplace safely? And what kind of protocols do we need to set up? And I have the perfect person to be able to introduce you to the kind of things that we need to be thinking about, the kind of protocols that are going to allow us to be safe. I have John Samuels here, who is the CEO and founder of Better Health Advisors. And I would like to welcome him right now. So, welcome.
Thanks, Sophie.
Welcome to you, John.
Pleasure
How are
to be
you?
here. I'm doing well. Thanks. I appreciate being here. Hope you're doing okay.
Well, we couldn't have timed this better to really have you here and be able to think about these gnarly questions, really, which is how do we deal with the different types of easing, the different restrictions we're dealing with, how to keep our employees safe as we go back to the workplace. Before we get to that, I'd really love to hear, a bit about your background. You have had a phenomenal career, looking after keeping a lot of people safe when they have been in ER situations and been running 16 ERs in the New York area. Please just sort of give a bit of an explanation of your background and how you really are the expert in this situation to give us some advice today.
Thanks, Sophie. So a lot of the work that I focused on in my 20-year career in emergency medicine and healthcare has been improving healthcare on the side of hospitals and working to make healthcare better for patients and for hospitals on that side. So in my work, as you mentioned, in emergency medicine, I oversaw and ran operations of a network of emergency departments throughout the Northeast, helping to improve quality, safety, operations, systems, and things like that. And part of the work under emergency medicine as hospitals are structured is emergency management and emergency preparedness. So I've studied a lot and done a lot of work in preparing for and managing crises such as 9/11, Hurricane Sandy, and things like that. My company now, Better Health Advisors, helps individuals and families and companies manage their health care and get the most out of the care that they need.
What were you, how were you sort of triaging? I know that you told me that you had been involved in the planning for the Ebola crisis, which thank goodness didn't hit us in the way that obviously this one has, and it's a very dramatic and incredibly fatal disease. But how I understand that through that planning process, obviously you had to consider some of the types of contagious challenges of dealing with a contagious disease, and obviously dealing with a hospital situation. What process did you go through, and how were you able to deal with that? In a hospital situation?
Yeah, so the work that we do in a hospital situation to manage these kinds of scenarios is first to identify the right experts to get in the room. So make sure experts are there and supporting the work that we're doing, and create plans. And it's important to create a plan that is thought through and takes many, many different scenarios into account, and then pilot the plan as much as we can, and then monitor, and then roll it out and monitor and amend those plans. And it's tricky with Ebola, with H1N1, things like that, and certainly with COVID, it will be difficult because COVID is changing as well. So we have to take that into consideration. So we should certainly expect the unexpected when we're getting back to work.
I see. So Now, how does one take that type of situation, the type of hospital situation, and really be able to use all of those amazing learnings and bringing that into the workplace? How can, obviously you're dealing in a hospital situation with medical professionals. Those are trained, they're focused entirely on healthcare. They're dealing with different situations, different levels of gravity when people are coming into the ER and how they need to be dealt with. Taking those learnings and being able to share them with people who are, quote, just coming into the workplace. Obviously, we're dealing with an incredibly dangerous disease that we have to be very thoughtful about. But how do you sort of transpose those and transition those type of that type of knowledge to be able to help us in our work situations?
Yeah, I think that every company needs to have a custom and thought through approach and plan. We need to look at what some of the OSHA and CDC standards are, use experts to help, monitor the plan, look at data as much as we can, because there certainly will be some data that comes out of it, and monitor the plan, as we go forward. Certainly there are things like, how are we going to train security guards and some of the front end staff in some of our procedures, and those are the kind of things we have to think through very carefully as we proceed.
So there are overall guidelines. I was given I was asked about what we can do. Is there a playbook that people can sort of apply? And you have told me that in fact there is, so to speak, a playbook that exists out there that you've just mentioned. What are the key principles there that can be utilized by different companies, whether they're huge companies or small companies? How can they look at those principles and use those to try and adapt? Because every single company is different, every single work situation, how many people they have in the office, how many people they need to bring back, or how they're going to space them out. What's the best approach?
Yeah, it's really tricky. Well, first of all, the first thing to do is, because there's a lot of fact versus fiction, with Corona, we need to get the right facts, and we need to follow the right organizations for the right information. And in this case, it would be the CDC and OSHA. They developed combined guidelines that prepare workers for the workplace. So we need to identify those guidelines and review them before we get back to work. There are some key tactical things that are mentioned in those guidelines, like conducting daily health checks of temperature, doing a hazard assessment of our workplace, looking at things like where communal areas are, which could be spreader for disease, encouraging employees to wear cloth face covering in the workplace, implementing policies around social distancing, and looking at what the ventilation system is to the extent that companies can. My company, Better Health Advisors, helps individuals and companies do this because there are guidelines, but implementing, managing, and monitoring those guidelines is certainly a difficult task for companies to do.
And how are you finding where people are? I mean, it's quite confusing in terms of trying to understand what to implement when, and how many people to advise to be coming back to the office. Obviously we're trying to keep as many people at home as possible. But what steps can people take to try and really sort of plan for what's the optimal, recognizing that this is going to be going on really for some time?
Yeah, so much of the response needs to be zip code and industry dependent. So what happens in a hair salon in Montana is different than what happens in restaurants, a busy restaurant in Manhattan, New York.
Right.
So key principles are stay on top of the standards, implement them, and manage the situation. But certainly there are several key principles around social distancing, around working from home if possible, around doing an individual assessment of individuals and the workplace, so that we can stay on top of this evolving situation.
how people are reacting psychologically. It's not just the planning piece of this. There's obviously a really important piece, which is helping people understand from a psychological point of view what kind of information is shared with everybody. Obviously, there are people who are planning, then there are also the people who are the employees, and how they need to be spoken with, and how they're reacting, and managing them, and what kind of information that they have, so that they know what they need to do to stay safe.
Yeah, this COVID pandemic has unearthed our anxiety pandemic that we've been having in our country for many years. And I think that employers need to amend the sort of standard Weight Watchers groups and things like that, walking clubs that were being done from a fitness perspective, which are nice and fine, but to add things that addresses the psychosocial challenges that people are going through. We are very concerned about increased alcohol use and substance abuse, what the isolation has done and will be doing to people, and the stress that people are living with. And I think that, there are groups and therapists and psychiatrists and other companies who are helping companies, in fact, manage this. And often it's recommended to address those things. And Sophie, sometimes companies won't think, oh, I have lots of people who need psychological counseling, because people often won't mention it. But if the resource is there, if an email is put out and says, we're working with XYZ company now, and they're doing groups on anxiety and stress, who wants to participate? And then you open it up and you have a flood of people joining. Those are very good things. So I would say not just respond to what you're hearing from companies, employees, but to proactively put in programs that addresses stress and anxiety in the workplace.
Yes, I mean, this focus the impetus there has been about dealing with well-being and people's mental health, and that not being a stigma. Absolutely. I mean, we really need to lean into issues of mental health, and just talking to people more, and really elevating the questions that need to be asked, and asked frequently. It's not just a sort of question of checking in once a week right now. And I think, now we have, there was a certain certainty about the lockdown. We knew that the lockdown was there, and that sort of governed what we had to do for X period of time. And now we have another period of uncertainty, which I think then raises certain stress levels with many people, again, because it's, again, well, what do I have to do? How am I going to manage this? And where am I going to be working, and when? And a lot of people really don't deal well with that much uncertainty.
You mentioned the check-ins, and it's nice, and I know people are trying to do it, and their thoughts are good on that. Their intentions are meaningful. But I think there can be more proactive things we can do than simply checking in, because often it's not, there's sort of things we can do more valuable than that. So my company, we didn't check in with people. We created a toolkit and resources for people about COVID, how to behave, what to do, different ideas and best practices, assessment tools, and we sent it to people and talk to them about it. So I think checking in, it's a great intention, but I think we have to work hard to be proactive in how we're helping people.
Very good point. And I really think that this is one of a key point in terms of philosophically really being proactive. And I'm always talking about empathy, and empathy both in leadership and management, and people dealing with each other, because we also don't know what's happening on the other side of the Zoom call or whatever video call chat somebody's doing, because it also can change from day to day, and somebody's relative might get sick, or a spouse, or something happened that we can't see, and we don't know. And now we're going to have a more complicated combination of home and work, and how do you see what are the ways that in your, you've talked to me before about really trying to evaluate each employee's risk profile. So how does that work if people actually want to individually try and be as proactive as possible about their own, how they're sort of bringing themselves to the workplace when they do go, and what kind of risks that they're taking and making sure that they can keep their colleagues safe?
Yeah. I think that's a good question. I mean, I think we have to communicate with each other about what kind of behaviors we're having at home. I think when possible, we need to try to mitigate risk when we can, meaning limit times where there could be exposures. I think that's helpful, and I also think that we need to continue social distancing as much as we can, because it's helped, and it will continue to be one thing that helps move the dial here.
You're thinking about how this works for most people who are in, let's just say, in smaller businesses in New York, and the first things that they need to be thinking about in terms of anticipating that New York, I mean, obviously there are 3 areas that are going to be opening up, but they're not near New York City. What steps can they be taking first in terms of just trying to understand the most salient points that they need to be thinking about, that they need to be communicating to their employees, and really setting everybody up for success, for safety in the coming weeks?
Yeah, I think the first thing employers should do is have a plan and have clear communication with employees about what's in that plan. And I think we need to think through different scenarios before they arise, so that if an employee calls one day and says their child is sick, what do we do? I think if we have answers to that before the scenario occurs, it only helps moving forward. And so I think having employers should stay on top of what's happening locally and nationally, and have a plan, and be able to monitor those plans going forward.
So scenario planning and building up a number of scenarios to try and sort of sort out who can be there when, and if this place opens up, and if that happens. I know there's been a lot of joking about Boris Johnson, who announced on Sunday, well, we could do this and we might be able to do that, and then if we do that, and then you might be able to. There have been a lot of memes floating around in terms of not really understanding, and what was he saying, and we can do something but not. So what are sort of a couple of, or 2 or 3 reasonable scenarios that people can plan for that would make sense, anticipating the easing of restrictions that Cuomo has laid out?
Mm-hmm. Well, I think one thing is, what we should always do, and hopefully this will come out of the scenario going forward, is if you're sick, stay home. So I think if people have any type of illness that could be contagious, stay home. I think that we should obviously, wear masks when we can, work to mitigate risk, and exposure and transmitting the disease. The formula for that is exposure dose times the length you're exposed of it times the location. So sitting further away from somebody helps mitigate the risk, and or working outside helps mitigate the risk. And exposure dose, which would be something like how close we are to somebody increases the chance of having a stronger dose. So there's things like social distancing, wearing masks, washing hands. A lot of the things that we're talking about doing at home, we need to also do in the workplace. And I hope that employers help facilitate these things by doing things like having lots of cleanser around, not having large meetings together, encouraging people to wear masks, and those kinds of, and not having spaces where are communal during the workday.
Some great advice there. What do you say? There are always going to be certain people who just don't believe that this is as serious as it needs to be thought of, and whether it is because they don't think they're high risk, or it could be that they're in a state where there's a very different perception of what needs to be done, and how risky it is, and those type of things. You know, there are different responses and reactions by different governors and mayors all over the nation. How do you approach that as an employer? Because obviously, you know, you have to try and keep everybody safe, and you have to, you know, how do you try and enforce those rules if people don't want to?
The risk for employers is that if individuals don't practice these recommendations, then they could have a high percent of their workforce get sick. And we've seen that happen with a lot of companies where 20, 30, 40% of employees are sick because they're transmitting the virus. So they have a business interest in supporting these kinds of measures. That's one sort of fact to this. And the second one is that, you know, we know in public health that behavior change is difficult. So in my ERs, we always struggled getting visitors to wear masks. We know historically in 1918, the second wave of the virus was more lethal than the first, and that there was also a masking challenge then. So, you know, these aren't new concepts, but getting people to change their behavior is difficult. But we need to constantly reinforce these guidelines and rules so that we will have a better chance at decreasing exposure. To me, there are 3 S's to being successful. One is being straightforward with communication, being single-minded in approach, and having supervision so that employees understand and are behaving in a way that's respectful of some of these guidelines.
Okay, straightforward, single-minded, and
supervision.
Excellent. Well, that's really helpful to have those sort of a framework for how to approach this. What have been the biggest challenges that you've seen? I mean, you are right now typically dealing with smaller offices, and where you can really, you know, have an understanding or interview people to have an understanding of each person's risk profile and manage it. It's sort of easier with a smaller community, a smaller office group. But what have been some of the challenges that you have heard about or experienced, or, you know, pushback about different things that you've suggested that people just said, like, I'm not prepared to do that, or it's, you know, or it's too expensive? I mean, some of, you know, how do you address some of those challenges?
Yeah, I think we need to mitigate as much risk as possible. So we're not going to bat 1,000 here, but if we're able to identify those items where we have the greatest impact on decreasing transmission of the virus, then that only helps move things forward. So if one thing is more expensive and can't be done, let's try something else. Let's try to continuously mitigate and decrease risk so that we're not in a scenario where people are being out of work a lot and sick from the virus. So that could be some people staying at home more often. That could be, at the very least, we're always going to wear masks. We're always going to take our temperature before we come in. We're always going to wash our hands 3 times a day. We're in a closed communal rooms. There are certain things that we can do, and there's lots of options. So I think we need to assess those options and find the ones that work best.
That's really good to know, and I think, with the combination of being able to use technology and be able to, I have previously talked about remote working, and that the way to have an equitable remote meeting, even if 3 people are actually in the office, it's a better idea to have everybody on have a small screen, and therefore they can actually just stay in their offices and not be in a meeting room together. And so those are some of the things that can be utilized to ensure that people keep their distances as much as possible. What technology? I also was interviewing someone recently who was talking about the fact that they had automated some processes in order to stop people from having to hand off pieces of paper, which of course now then become much more dangerous because they could be carrying the virus. Are you seeing and recommending new digitization of processes or different uses of technology in other ways that can be helping people keep safe and not have as much physical handoff or physical proximity?
Yeah, great question. I mean, I love improvement science. I studied Lean and Six Sigma for years, and that a lot of the work that we do in emergency medicine comes around improvement science. And I think we have to think through these workflows and appropriately and professionally push back on, no, we always pass the paper this way. No, we always have to have a meeting in person, and so forth, and really examine our workflows and pilot new ones and see if we can change the way some of our business has been done. We have done a lot of this already, as a lot of us are working from home right now, and we can use those kinds of modifications and build on them going forward. And I think that'll certainly help us with this. And you'll see some of the tech companies like Google and Facebook, look, they're not starting working again until January. So, restaurants are using Uber Eats and
Right.
And Grubhub. So we have to think more strategically about it, and really challenge our previous workflows and beliefs to try to get to where we need to be with this.
So that sounds like you're very much in the same mind that I am, which is whatever workflows we had before, which we might not have been even really be cognizant of what was happening and who was passing what to whom and when. Now when we remote working, we've had to be much more thoughtful and define each one of those things. But when we're moving forward, it's not a question of going back. It's not a question of sort of saying, okay, now we can go back, thankfully, and sort of pick up where we left off, because designing these new workflows and being able to look at the different pieces, along the process and design them differently in order to make sure that every single step of the way that we're being thoughtful and careful, and have we tried to mitigate the health risk at every single step.
Yeah, and again, in improvement science, we use something called a payoff matrix to look at this. It's a 2x2 chart, and we often will look at something like impact versus effort. Okay. And we can look at the impact of certain workflows versus the effort or the will be involved in making changes to them. So I would encourage employers to map out some of their workflows and look at it from what is most impactful and how do we decrease risk. We're not going to be at zero, but how do we get as close as we can to it with minimal highest impact and lowest effort. And one more thing, it's important that when we do this, we have the right playbook out and guidelines so that we're really impacting the most important things.
Got it. And in terms of, I have this sort of feeling that there are a lot of people who have this pent up, like, oh my God, I want to get out of here. I mean, a friend of mine in Paris actually today had the first day back in the office, and he has his mask on and everything. But he, there was this pent up energy of just being able to get out of his apartment and being able to go to the office, which was mostly desolate. What can you say to people who to try and prevent people from having an incredible excitement and just and really not adhering to the kind of rules that we need to follow, because we're just so excited to have a change. Really, I mean, some of it just as basic as that.
Well, I understand that, and I think there are things that can be done that are within social distancing guidelines around that. So playing tennis, playing golf is certainly less risky than going to a club and being around a lot of other people in a crowded restaurant. So we're seeing examples in other countries who are further down the line than us when some of these risky behaviors, like going to a club, and can certainly transmit and pass the disease and bring us back to where we were before. So one of the things that's important is that this is not an individual exercise. This is a group exercise. And we have to treat it that way, so that there's a reason why the projections around how many deaths we're going to have in the United States is so broad. The projections are very wide. And one of the reasons for that is because we don't know how well people will adhere to social distancing. And if we as a collective don't do well with that, then we're going to have more infections and more deaths.
That's a very good point in terms of the fact that this is a collective effort, and very nicely said like that, because that's where also this idea of empathy again comes into play, in terms of it's not just about me and my health. Everything that I do has an impact on everybody else. How do you, I talk about empathy. I talk about sort of like trying to, have better and deeper relationships. And I think there's some really interesting connections that people have made in the office, all dealing with these difficult situations. How do you recommend in an office environment, with a team environment, to be as mindful as possible about each other, when it's not just rules, it's about, mindset, it's about approach and those type of sensibilities?
I think that companies need to can recognize that we're all going through this together. And, as you ask people to come back or work certain hours at home or wherever, we don't know the struggles they're going through. We don't know if their grandmother just died or if their child is sick. We don't know. So I think we have to recognize that some of the world has changed, and that we need to meet people where they are. Certainly, it's a more humane way to work with people, but it also helps support one's business interests as well.
And so I have to ask, because, it is very much on my mind, just knowing that when we're establishing new protocols, we've talked about building scenarios, a second wave is coming, and however soon one wants to believe that it's going to be happening, looking at a whole load of data and projections, it looks like it could well be the end of June, beginning of July, based on just people going back to work in some degree with the phases, and starting off well and then not doing so well. And then, there's a lag of 4 to 6 weeks in terms of what happens after that. What do you, in terms of being able to pivot, in terms of both understanding workflow, looking at the scenarios, how does one plan? What are the time frames that people should be looking at in terms of getting ready? That preparedness, having the plans in place, but having the plans in order to pivot and change people's ways of operating. How quickly, what kind of warnings should people do? You're used to turning on a dime, I'm sure, in the ER when it's dealing with something as dangerous as Ebola. But in a workplace scenario, I can imagine those time frames. People sort of the average person is not used to changing with that kind of with those kind of time frames, even though we just did, I know. So what would you suggest?
Yeah, I think that we don't. There are a couple things right now that we don't know. So one thing we don't know is how well having antibodies creates armor for us going forward. We don't know that. And we also don't know, getting to your question, how the easing of social distance rules will create more of a comeback with infections, the second wave. It will create one. We don't know how significant or how aggressive it will be. So to that end, we have learned a lot now from companies about working from home, creating new workflows. And, I think that companies need to be able to turn a switch and be able to go back to this mode when necessary, because we don't know if it could happen again or never, or where it could happen, or if it could happen in September during back to school or November during flu season. So in my ER, we had downtime procedures, we call it, which were always ready if in fact we had the IT system go out and the computers didn't work. So, and we dragged out a board and started doing it. So we need to now have downtime procedures for companies where we can get ready for these kinds of scenarios, because we can certainly expect that it's likely to happen again. We just don't know when or the extent of it.
Okay. So actually making sure that we have gaps, or making sure that we have periods of strategic time to, taking time to allow those type of planning that needs to be incorporated into into managers and executive schedules in order to really be always alert to this. Okay. So that's on top of everything else that we're needing to deal with.
And I think to that end, really focusing on communication. One of the challenges we're having nationally is this fact versus fiction thing.
Right.
And it's a very good thing to give to employees. Here are some great websites that people recommend you use. The CDC and the World Health Organization, and a website we use called Up to Date, and Johns Hopkins, and some of the academic journals. So, and giving educational materials to employees so that we level set, and that when we're referring to certain things, they'll understand why we're creating such policies and procedures. Because people are going to push back, and if we gave them some of that information, it certainly might help.
And how? Obviously, every company is different, but there are many people who are fine with receiving lots of information and lap it up. But there are also many people who just they don't want that much. What do you recommend in terms of, is it a question of just sort of saying, this is the key information you need to know, and then the rest of it is, you can go and find it, it's on the board in the cafeteria, or on a internal company website, so that people know whether to find whatever information, whatever amount of information that's going to make them feel comfortable with what's going on.
Yeah, just like my company has done for our clients, organizations and companies can put out information about fact versus fiction, and I think that the tricky part here is also that people sometimes are overloaded with information. They're reading and reading and reading and reading, and then they get overloaded, and then it creates anxiety and so forth. So I think being selective about what we're communicating, but certainly giving people more information, places to get more information if they're interested, would be a good thing.
Is there anything, what haven't I asked that is really critical for businesses to understand, either small or medium-sized or larger businesses, in terms of what they should be thinking about, or what information they should be really considering, that isn't as obvious, that is perhaps more, it's in the fine print, it's on the 5th page, but are also critical pieces of information that people ought to know when they're going through this planning process?
A couple of things. One is that we need to be flexible and know that it's This is changing as we go. I think that's important. I think that communicating well and companies doing that is important, and having transparency around that is a very good thing. I think employers should also recognize that a lot of the non-COVID health needs of employees have not been addressed for the last few months. So someone with shoulder pain or back pain and things like that, they should be thinking about how to get them telemedicine and other ways to address it. So I think those are some of the things that can be communicated.
And what have or else haven't I asked in terms of? I mean, you yourself, you providing. Do you want to just give a little overview of the services that you're providing? Because you're not typically dealing with big organizations. You are focused on smaller entities, and just give an overview of that, because I think it's very interesting to understand how that approach, how the approach that you take, and what that service offers to the businesses that you're serving.
Sure. Our company helps individuals and family offices, hedge funds, law firms help manage their health care, identify the right doctors, get into treatment, attend appointments with people, and create a health plan for people. So the same way I recommend people having a COVID plan at home, I recommend people have a plan for Alzheimer's, Parkinson's, cancer, heart disease, things like that, and have experts like my team and I support that treatment. So if an individual sells their company and says, I'm going to now, what do I do with my wealth? I hope they don't Google, how do I manage my family fortune? They use experts to manage their money. The same way with us. They use experts to manage their health care. That's the work that we do at Better Health Advisors.
Fantastic. That's very helpful. And thank you for sharing that. And obviously, what you were doing before in terms of looking at all these different situations, obviously COVID-19 has changed the focus of a lot of what you're dealing with. And I imagine we'll do for quite a significant amount of time. But hopefully we'll start to understand how to deal with this we're good as human beings. We're very adaptable. We get used to things, and also being used to being adaptable and being able to deal with different scenarios easily, and being able to go between okay, so now we have to be more careful. Now we have to, go back to, scenario B when, 2/3 of people were working from home again. I think we will get used to that, and I think it will become much more adaptable overall in how we are working. And I think that for me is a good thing. Not the reasons why we're happy to do this, but being able to be more responsive and pivot and obviously if somebody has multiple offices, they're going to be dealing with different situations, in their different locations. Which I think must be, have you dealt with that in terms of recognizing that or how to adapt for, in New York, we're dealing with this situation, but over there, they're dealing with that. That must be quite confusing for employees, I would imagine.
Yeah. I think some of the principles remain, which is every additional contact we have with people is a potential opportunity for transmission. So when we have our family circles with our families, and every time we break the link, we are potentially creating an opportunity for a transmission of infection. The same way it goes with companies. So to the extent at which we can keep our team small and keep it with the same people only helps prevent the potential transmission of the virus.
That's super helpful. John, is there anything else that I haven't asked you, or that I should have asked you, that is useful for people to know as we move into the next phase and phases, and stepping forward and stepping back, and whatever is ahead, and how it, obviously you've shared an incredible amount of useful information and advice that can be helpful to companies of all sizes, and executives, managers, and employees. And I really, really thank you for all that you've shared today. What else would you like to show us before we wrap up?
I think that there's two things. One is that we're seeing nationally a trend in people being afraid to go to the ER for critical things like heart attack, stroke, and things like that. So from a public health perspective, if somebody does have a non-COVID but life-threatening emergency, we need to go and get treatment for that. So that's one. The second thing, though, is that although we are in a difficult time, in addition to people being adaptable, I think people are resilient. And I think that there's a lot of reasons for hope. I think we will get through this. I think we need to be thoughtful and recognize a lot of the good things that have come of this. Thousands and thousands of people have recovered from this. There's been great partnerships between private companies like Bloomberg Foundation and government agencies. And I think it's wonderful to see healthcare workers being recognized for their work and their heroicism. So I'm really happy to see some of those signs of hope and hope that we can move some movement forward with vaccines and antibodies and other things that will help really move the needle over the next few months and years.
Yes, I thank you very much for all of that. And yes, absolutely. I'm so thankful to all the healthcare workers around the world and everything that they're doing and the really heartbreaking stories that I hear and the trauma that so many are going through. And, the fact that we do now really understand and value everything that they're doing in normal times and during these very, very difficult times. So thank you, John, for reminding us of that. And thank you to everything that you have done and all the people that obviously you've been working with and what they do. So John, to wrap up, thank you very, very much again for everything that you shared. And this has been recorded, so this will be available to be able to look again and see some of the advice that John has given about how to be preparing to go back to the office amid different easing restrictions and whatever possibilities are available to your particular company and your particular work setup. But thank you very, very much, John, and really appreciate the time and wisdom and planning and scenarios that you have explained to us today. Thank you.
Pleasure to be here. Thank you so much, Sophie, for the time and in our discussion.